Okay, we're gonna do a functional or squat assessment. This is case number 9. So it's nice to do in front of the posture analysis grid chart here, but you wanna instruct the patient to have their feet hip to shoulder width apart. Their toes should be pointing forward, and you're gonna have them raise their arms, both arms up above their head. And the clinician wants to observe from 3 different angles: anterior, lateral, and posterior. So when observing from the anterior angle, you're mostly looking at hip and knee movement. And so you're gonna have the patient or client perform 5 squats in each angle. So we'll go ahead and have them do that. And we're watching for hip and knee when we're standing straight on. Good. Now in this case, number 9, patient is going to have a valgus deformity, so his knee should move towards the middle. And you'll see that on the left side there as his knee moves in. So there are 5 possible overactive muscles when you see this compensation. It would be medial hamstring, medial gastroc, glute med, glute max, and vastus medialis. Thank you. All right, so we are going to focus on strengthening of the glute max muscle today. So we'll have the patient go ahead and lie on your back, and we're gonna instruct them in some bridges. So I want you to keep your feet flat on the table, so bend those knees up. And what we're gonna do is have you lift your hips up off the table and try to make your body nice and straight as you come up. And good. Now I want you to squeeze that muscle, your butt muscle, as you come up. Good. And back down. And once the patient can do that in a controlled manner, you can add some resistance. So go ahead and lift your feet. I'm gonna put this band around your knees. And what I want you to do is perform that same bridge motion. So flex up, and then I want you to, after you're up, I want you to squeeze your legs out, and you should feel contraction or muscle contraction in your hips. Good, and relax. So after the patient can perform this in a controlled manner, you can still progress it. We could also do single leg. So let's take the band off. Thanks. And progress 1 leg at a time. So good, just one on the table. The other one, keep it out straight. Good, and hold it there. Try to keep this here and perform the bridge. Good, all the way up if you can. And if he's able to control that, then we can move into a single leg Bosu ball bridge. Good, so he's stabilizing here and bridging up. Good, and a further progression. You have to make sure that they can handle those first before you move on to any harder. And we can also add a little weight in there. Good, strengthening the glute max muscle. Good. A progression of exercises for the glute max. Once the patient is able to do a variety of the strengthening, endurance exercises that you've challenged them with in the clinic, you want to move on to a variety of open and closed chain functional activities. So we'll have him start at the top of the platform here, and once he can perform a jump down and stick that jump and show me that he's not moving his legs towards the midline, then we progress to the next phase where he would jump up onto the next platform. So what I'll have you do is jump down, stick that landing, get into a nice partial squat, and then go right into the next phase up onto the next platform, jumping up. Good. And the clinician wants to kind of watch from the front to make sure that his knees aren't moving in.